While staying in China, the country's President Xi Jinping is today presiding over an extraordinary China-Africa summit on solidarity against COVID-19 in Beijing. Xi is expected to deliver a speech at the summit held via video conferencing against the backdrop of the deadly coronavirus pandemic. Chinese authorities have been actively sharing their experiences with their African counterparts. Now, according to official reports, medical experts from China have conducted nearly 30 virtual conferences with dozens of African countries as of mid-May. In addition, medical support, including personnel, has also been sent to at least 5 parts of the continent. Let's get you more on this now from our reporter He Weiwei, joining us live from Chongqing City in China. Weiwei, from the time the coronavirus pandemic was declared, China has been sending medical teams and material support to Africa. Tell us more about this.
Well, Lindy, so far China has sent over 20 medical teams to countries across the world to help combat COVID-19, and 1/3 of them, 7 teams of them, were being sent to African countries, and I followed one of those teams. It has 20 members, and it is so far the largest team that China has sent overseas for the COVID-19. And we just got back from Africa 1 week ago, and so we've been to Algeria and Sudan. The 2 countries were seen as among the worst hit countries in Africa, and for each of the countries we stayed there for 2 weeks. Now let's take a quick review of our trip there in Africa.
I am feeling confident, though a little bit scared. I have learned from the COVID-19 outbreak that the world is a community with a common destiny.
Algeria has reported today a relatively large number of cases for Africa, 6,067 cases and over 500 deaths. Its mortality rate is relatively high, reaching nearly 10%. Our team will come to learn about development of the spread of the epidemic and treatment in Algeria first.
It's the first time that a reporting crew is accompanying the team abroad, and it's us, the CGTN.
The wards are good, all equipped with necessary devices for the COVID-19 patients. The number of doctors and nurses are sufficient. They're taking good care of the patients inside.
We in Algeria, especially the health sector, are glad to see the Chinese medical team. Your visit demonstrates the strong relationship between Algeria and China. We need China's experience. It enables us to boost our efforts to fight COVID-19.
It's half an hour before the show, and we are now entering the studio for preparation.
Since the outbreak of the pandemic, China has been concerned about the situation in Africa. At the 73rd World Health Assembly, Chinese President Xi Jinping announced a series of initiatives, such as establishing a cooperative mechanism of its hospitals to pair up with 30 African hospitals and to accelerate the building of the Africa CDC headquarters. These initiatives will undoubtedly contribute to the development of health services in Africa and strengthening China-Africa health-related cooperation. I believe that with the joint efforts of both sides, China and Africa will set a good example in building a community of common health for mankind.
Well, as you can see in the video, the Chinese doctors during their stay in Africa, they held in-depth talks and communications with frontline doctors in Algeria and Sudan, and also they visited patients. They also held talks with local health officials, and also they held some training sessions for local residents as well. So their efforts have been widely recognized by the Algerian and Sudanese society. Lindy.
Certainly seems like an incredible trip, Weiwei, and it just really brings us to today, this extraordinary summit that's taking place in Beijing on solidarity in fighting COVID-19, coming at a time when African nations are certainly seeing a rising number of cases of the coronavirus and feeling the burden of dealing with it. Weiwei, in what way do you think China's approach to this pandemic can be adapted to suit the African context?
Well, Lindy, actually, this question is among the major topics that have been frequently discussed during the communications between the Chinese doctors and the Algerian and also Sudanese officials and frontline doctors. And I think as we know that COVID-19 is a new virus, we still have very limited knowledge of that. So at the moment, there is not a single solution that can be adapted to all nations. So what the Chinese doctors did in Algeria and Sudan is to share China's experiences freely to those countries. And before they leave the country, they delivered the reports to both of the governments. And in this report, they mentioned some of their observations of the measures taken in those two countries, as well as their suggestions. And also, there's something common that the two countries also share. For example, they all face shortages of medical supplies, and also they need to increase their testing capabilities. And also, the Chinese doctors suggest that the Chinese principle is that we will move all the COVID-19 patients at designated hospitals, for example. But in those countries, maybe that is not that practical. So as the official from the Algerian health ministry told me, he thinks that the most important thing the Chinese doctors share is some reference that both countries can take to evaluate whether the measures that are being taken right now in Algeria and Sudan are efficient, are enough or not. For example, when we were in Algeria and a curfew was imposed, so at night we're not allowed to go out. But by the time we left Africa, such curfew has been gradually lifted in some areas. So all these experiences that Chinese doctors shared come with great help of the local government to evaluate their treatments as well as the prevention measures. Back to you, Lindy.
Thank you so much, He Weiwei. That is very fascinating indeed. Joining us there live from Chongqing City in China.